Okay, welcome everybody to the Western Pacific Climate and Health Responder course. This is session 4 on temperature-related illness and mortality. I'd like to take a moment to thank all of the collaborators and the Columbia Mailman School of Public Health for putting on such a fantastic course. The course objectives are to increase health professionals' knowledge, self-efficacy, and communication skills related to climate change and health, to expand global workforce capacity, to develop and implement educational programs on climate change and health, and to build and strengthen an agile and informed community around climate and health education, advocacy, and policy. Today's session is session 4, and the focus is on temperature-related illness and mortality. The specific learning objectives for today are to identify current and projected changes to temperature and risks of extreme heat events in Asia Pacific, to define the heat-sensitive health conditions and cite examples of how heat impacts the pathophysiology of cardiovascular, renal, respiratory, neurologic, and maternal health, to identify medical diagnoses, medications, and other health determinants that make patients more vulnerable to climate-related health threats, and steps that health professionals can take to reduce these risks. We'll be describing the role of public health practice and collaboration with the health system in preparing and responding to extreme heat waves. And finally, we'll be exploring the role of heat early warning systems, public health surveillance, hospital-based surveillance systems, and other measures for monitoring, mitigating negative heat-related outcomes. The logistics for today: this is a 90-minute session which includes expert lectures and case study presentations, and the sessions will culminate in a question and answer session at the end, and your questions for the presenters will be in the Q&A. So I want to remind you at this point to put any questions that you have as the speakers do the speaking, to put into the Q&A of the webinar link. You'll see it. And the sessions will be recorded. The slide decks will be made available, and you'll be able to see that on the course website. Attendance is automatically recorded during the live Zoom sessions. So your attendance is only counted if you use your personal Zoom link. Your attendance is not counted if you join with a colleague's link. And YouTube views sadly will not count towards attendance. There's going to be a certificate of participation to those who attend 70% of the live sessions and pass the final exam with a 70% or higher score at the end of the course. And that will be a certificate of participation, but you have to use your email link, your personalized Zoom link to do the session, and you've got to do all the sessions, to do the exam in one go, as in one sitting. There is a WhatsApp group, and that will close on Sunday. So that the exam link will be sent on the final day of class via email and the WhatsApp group. So that will close on the Sunday of the last week the course is on. There's going to be 25 multiple choice questions with true or false kind of answers, and you need to do that in one sitting. So over to the presenters now. So just to tell you, today we've got 3 speakers. We've got Jason Lee, Zhang, and Kazutaka Oka. So I'm going to take a moment to introduce Jason Lee. He is an associate professor at the Yonglou Lin School of Medicine in National University of Singapore. He directs the Heat Resilience and Performance Center and co-leads the Human Potential Translational Research Program. Jason completed his 12-year tenure at the DSO National Laboratories in 2018 by directing the Human Performance Program in his final appointment. He's the fellow of the American College of Sports Medicine since 2012, and he served in various national and international panels related to human performance and safety. Jason studies the physiological demands associated with passive and exertional heat stress, and how humans adapt to ensure optimal performance and survival. Over the last 2 decades, knowledge gained from his research has translated into several local international policies across various governmental organizations. Over to you, Jason. Thank you so much.
Thank you, Raksha. Let me put up my deck of slides. Okay. Can you see my deck of slides? I presume so. Yeah, if I may, first, good morning, good afternoon, and good evening. I was told that there's a lot of participants around the world. I'm actually currently in New Delhi for a couple of heat-related events. It's 6 a.m. at my end, and I'm dressed for the occasion. In this case, batik from Indonesia to remind me, and that's my very first point, to remind everyone is context, context, and context. Yeah, so now in APEC, we face increasing risks from extreme heat due to climate change, with temperatures rising, heat waves impacting more of us, more intense, more frequent. So it's important. It depends where you are based. It comes in the form of acute heat waves. And for some of us, it's perpetual, we call it slow onsets, impacting how we live and how we work. And also in this session, you heard the objectives. Take this as a teaser because we don't have time to cover all the content. I hope many of you will be inspired to read more on this topic, but more importantly, I ask that you will go back and do something about it. In APEC, current trend shows a rise in temperature and increased frequency and intensity of extreme heat events. The projections indicating further warming and more frequent and longer, hotter heat waves by 2050 and beyond. So, however, wherever you look at it, we know temperature will continue to climb. As I say, how heat affects you is very much contextualized. So remember, it's context, context, and context. And in some parts of APEC, it's not just about high temperatures. It's also the issue of high humidity, long exposure. So our behaviors have been shaped and reshaped, resulting in poorer health. I shall elaborate more. I like this depiction because it represents some of us, many of us. Many of us, I call us the boiling frogs. We really cannot allow this to continue. You could say a small snowball could trigger an avalanche. Another drip could overfill, and a cup that is close to the brim. So we are very near that threshold. Our leeway is getting tighter and tighter. So don't get too comfortable in this boiling world, guys. So now we need to take actions with great urgency. To become heat resilient will be even more essential as the world gets warmer, as I say. You can see here how heat affects us. It's not just about heat-induced mortality. So don't go about assuming if there's no death means it's not an issue. You can see it from a health pillar's perspective, how heat is compromising how we rest, how we sleep, how we recover, how we eat. Stunting issues remains very real in our part of the world. Heat also can suppress outdoor physical activity. So from a health pillar perspective, this is how heat can affect us. You can see it from a life course perspective. Infants, very young children, youths, adults, elderly. You can also see it from a population specific. And always prioritize resources to the most vulnerable. So ask yourself, if you have that $1, who you want to allocate that resource to. My team has prepared this short video to illustrate just one of many aspects, often less discussed about, but this is just one of many examples. I'll play how extreme heat can have negative impacts on males' fertility.
We can't hear the sound very well, but we can see what it's saying at the bottom, just so you know.
Okay, I'm aware. I just heard you can't hear the audio. That there are captions below, so I hope you still get the gist of what the short video is trying to relay. More importantly, I hope you can still hear me. Okay, heat-sensitive health conditions are essentially health conditions that can become aggravated when one is overexposed to the heat. So to understand why this happens, let's take a look how our body's thermoregulatory system works. So I'll play this animation. So when exposed to the hot environment or when exercising, your body core temperature rises. We call it heat strain. A raised core temperature kicks off a series of thermoregulatory responses that attempt to cool down the body. So one response revolves around the circulatory system, meaning more blood gets directed to the skin. In the process, we call vasodilation, allowing more heat to be dissipated to the immediate environment. So in this case, the heart beats faster, demands us to keep up with the body's cardiovascular demands. The other response we are probably more familiar with is sweating. So as sweat evaporates, so the key word here is sweating does not make you lose heat. Sweat evaporation does. So when sweat evaporates, heat is removed from the skin surface. So at this stage, our body can lose heat efficiently as the rate of heat loss matches heat gain. So this is what we call compensable thermoregulation. So far so good, no problem. Your body can deal with the heat gained so far. Prolonged exposure to heat can also cause fainting, also known as heat syncope. Here, I use another video to depict what heat syncope is. It's very common for those who have seen parades, in this case, military passing out parades for the recruits. You see not one, but two soldiers that sort of feel lightheaded and that fell. Most cases, they are fine, when the blood gets back to the brain. But can you imagine this situation happening to a worker depicted on your left, when some could fall from height due to heat exposure, causing lightheadedness. So there are also other indirect impacts. One could succumb to overexposure to heat. So be aware of that too. So it's not just heat, direct or heat-induced mortality. And with chronic conditions, the body's ability to thermoregulate, or we call it thermoregulation, can be impaired, leading to increased physiological strain. This can exacerbate existing health issues you already have and make it more challenging for the body to cope with the heat. So look out for individuals, especially the elderly, who already has the limited physiological capacity and see heat as another stressor, aggressive one, that can compromise the already compromised physiological capacity. So, for example, excessive sweating can lead to dehydration. This will reduce the blood volume. So now the heart has to work harder to circulate the blood, increasing your overall cardiovascular strain. At the same time, when one becomes dehydrated over time, the kidneys have to work harder to conserve the fluid, right? Which can induce strain and potentially lead to kidney injury. And in tandem, you see there are so many things happening at the same time because there's a competition of that limited blood and oxygen to your vital organs, to your muscles if you are working, and now to the skin to dissipate the heat. So in tandem, vasodilation can cause our blood pressure at times to drop. This can reduce blood flow to the kidneys, impairing their function, again inducing kidney injury. So when one is overexposed to the heat, right, the demands on the cardiovascular system increases, meaning blood required again by now the vital organs, because you need to have them functioning. If you are working now, the same blood oxygen needs to be competed to the working masses. And then we do all this in the presence of heat. The blood needs to be competed at the skin surface. So you see, a limited pool is competed by various requirements. So increased heart rate can put more pressure, more strain on the heart, increasing the chances of heart attack or other heart-related issues. So see it that if you really have a health issue, heat will further exacerbate them. A hot and humid weather can make it harder to breathe, especially for those with asthma or chronic obstructive pulmonary disease, in short, COPD. Heat can also worsen air pollution, including levels of ozone and particulate matter, which can trigger, again, asthma attacks and worsen existing COPD symptoms. Indirectly, thermal discomfort, that is very relevant in my part of the world, in places where you are almost chronically exposed to thermal discomfort outdoor. So that can suppress outdoor physical activity. So there's almost no concept as incidental physical activity. Every step that we undertake is almost intentional. So if you decrease your outdoor physical activity level, you will definitely reduce your overall health and fitness. And then the vicious cycle occurs. And now you have poorer physiological capacity or system to deal with any stressor, including heat. At the same time, existing health conditions also increase the risk of incurring heat stroke. So when this happens, the thermoregulatory system now becomes insufficient, unlike what I shared earlier. As a result, now the heat gain exceeds heat loss. So if no cooling is provided, that's also an important therapeutic first aid measure. Cooling must be provided as aggressively as soon as possible. If not, one can enter into a non-compensatory thermoregulation state, where the body heat strain or core temperature rises almost uncontrollably. So I play this animation. When this happens, the responses that help us in that compensatory phase now may work against us instead. For example, I talk about vasodilation. It might help us to transfer the heat, but now has the consequence of reducing blood flow to the internal organs. As a result, our gastrointestinal tract potentially could receive less blood and therefore oxygen. So this GI tract then gets damaged, becomes more permeable. You really don't want the toxins that were residing in there to leak out from your gut into the main blood circulation, causing this condition known as endotoxemia. So in response to this, now the whole immune system is triggered, resulting in widespread inflammation, also known as systemic inflammatory response syndrome. If persists, right, this can lead to multiple organ failure. The excessive strain on the heart may cause it to fail, cutting off oxygen supply to vital organs, inflammation, and resulting of lack of oxygen causing brain death. So look at this cascade of events. If left untreated, the heat stroke can cause permanent organ damage and even death. So we really want to avoid this. Every exertional heat stroke death is preventable. I say it again, every heat stroke death is preventable. And also, we cannot see these cases as just pure stats. Those are actual lives and they are preventable. And also be aware, some medications for treating chronic conditions can also impair how we lose heat. There is some evidence to suggest medications for diabetes, cardiovascular conditions, neuropsychiatric conditions or disorder can disrupt thermoregulation at different stages. I shall not elaborate, and therefore, making patients more susceptible to heat stress. But this is an area that requires more research. It's very difficult, to do a randomized control trial in this context. Understandable. So more research is needed, but at least, when one prescribe medications in the context of hot environment, the physicians, for example, should be aware of the associated health risks due to heat exposure. Beyond chronic conditions and medications, other factors can also make patients more vulnerable. Demographic factors can impair thermoregulations, you see here, as in the case for elderly, the infants. Social factors such as social economic status, social isolation can also expose more to heat risks and reduce their access to timely help. So be aware of these risk factors and you put all this in the context, you make a better assessment who are at risk. So it's not just about the hazard, the exposure, your sensitivity. It's also about one's ability to respond to stressors in life, in this case, heat stress. Okay, so what can the clinicians do or the caregivers do? First, identify risk factors that make patients more vulnerable to the heat. Inform them about heat risks and the associated symptoms. Educate them on steps they can take to manage heat risks. There could be potential adjustments to the medications regime when prescribed during hot seasons and or when the patients are under heat stress. Prescribed cooling measures in tandem to these medications could be a way forward. And this knowledge, must not just be confined. It must definitely be taught first in medical school. There is a gap there. But to the caregivers, it's important. This knowledge goes all the way to the last man and woman. We can't just put this at policy level. This must be shared all the way to the last man and woman. Okay, the good news is we do have solutions at hand. I'm an exercise and thermal physiologist, so I will be biased here to focus on physiological solutions that could beat the heat. You see aerobic fitness conditioning. So taking care of self, be fit, aerobically fit and healthy is a great way, in fact, the most powerful way to protect yourself against extreme heat. Heat acclimatize. Don't shun away completely from the heat. Heat is a stressor. Use it correctly. It can be a eustress and not always a distress. So before the heat season comes, if there are opportunities for you to be exposed to the heat in multiple bouts, shorter exposure accumulatively, you should be better prepared against the summer season. And harness cooling methods, pre-cooling here. You can also employ per-cooling, means cooling options during work or exercise, and cool yourself down after work. Optimize your work-rest cycle. The correct optimization of work-rest cycle not only will protect you, it can also maximize work productivity. It is a myth that more rest means less productivity. It's not true. In many workplaces, the employees are paid by a fixed sum. So if you don't incorporate rest, expect huge presentism. So you're being unproductive. You're not even aware. You are not maximizing your potential. And of course, hydrate appropriately. So with all these 5 solutions, 5 techniques here, it should augment your heat resilience. This is one of my favorite slides. Always show this in my presentation. Imagine you are not harnessing any technique to beat the heat. And here everyone has your own thermal capacity. On the y-axis, we call it thermal strain, your personal capacity. On the x-axis, your ability to work in a hot environment. So harnessing those techniques or solutions I talk about should reduce your starting state. That means your body temperature. It can attenuate the rate of rise, means you accumulate heat slower, predominantly because now you have the ability to lose heat more effectively. You may even have a new limit on your heat tolerance, because by doing so, right, each of those techniques has impact in each of these phases. You can enhance your ability now to tolerate heat strains. So look at now your y-axis is expanded. For example, your resting temperature was 37.5. You could exercise till 39.5. That is 2 degrees variation. With this reduction in resting body temperature, attenuation, and extension, you could start much cooler, 36.5, 36. You can end higher without any health implications from, say, 36 to even, we have seen runners finishing races at 42 degrees Celsius and they are perfectly fine. Yeah, so from 2 degrees window to 6 degrees window, that's almost what's like 3% improvement in your ability to deal with heat. Note, there are no air condition mentioned here. And again, air condition is a good invention, but use it correctly. The problem in our society is the most vulnerable often are not given resources, including air condition. So air condition can still be used. Don't dump it altogether, but be allocated to those who need it most. And another tip here, I was told and I was taught, when you use air condition, always turn on your fans, which means you probably will increase your thermostats, saving energy and saving electricity bills too. Another point to note before I conclude is it's important to know the key determinants of heat strain, how hot the person is. So do not assume a hot environment always results in a hot person. And in the same light, more importantly, do not assume humans will not become hot when the weather is moderate. Because now, from this simple slide here, I hope you understand the 3 key determinants of one getting hot. It's not just the weather, but it's also the attire and the physiology. The physiology means the physical capacity of the individual, what is the work profile like, how much heat he or she is producing. So all these are important factors to consider for us to determine heat strain. Remember, it's the hot body that we are after, heat strain that we are concerned about, not just a hot weather. Okay, my final section, yet again, and I want to remind APEC, experience a wide range of weather and climate patterns, faces increasing risks from extreme weather events exacerbated by climate change. So it is essential we are aware of the issues at hand and come together, integrate climate and health sciences and services. It's therefore vital for us to address the growing health risks from climate extremes and variability. Climate services for health are essentially a form of partnership, defined as this iterative process of collaboration across relevant partners, multidisciplinary, to identify, generate, and then to build capacity. The outcome of a good climate service should deliver, first develop, deliver, and use relevant and reliable climate knowledge to enhance decision making and actions to protect not just lives, but livelihood. Again, I want to emphasize that many of these individuals that we are talking about prioritize, like it or not, livelihoods over lives. So if you want them to take actions, make sure that your advisory does not compromise their livelihood. So here is a good set of good practices and approaches derived from experiences, gap analysis, expert opinions, evaluations, and evidence-based findings. So employing these principles should guide actors toward a more successful partnership and therefore outcomes. Finally, there are many resources out there on heat health. I want to call upon this very good one that you can refer to for more information. The Global Heat Health Information Network is essentially an independent, voluntary, and member-driven forum of scientists, practitioners, policymakers, and they focus on improving capacity to protect populations from this, what we call avoidable health risks of extreme heat. So GHIN, the Global Heat Health Information Network, in short, seeks to improve capacity for professionals, organizations, governments in response to extreme heat. So as mentioned, good health advisory needs to be contextualized. There is no one size fits all. So here you see the GHIN Southeast Asia Hub made for this region, in this case, Southeast Asia. So these regional hubs, again, seeks to advance partnerships, collaborations to protect Southeast Asians, in this case, from the ill impacts of extreme heat. So you see our specific goals, focus areas. I shall not elaborate. For more information on the hub and on the center that is hosting it, you can scan the code. I know you have the materials for more information. Okay, with that, I thank you for your attention. As I say, it's meant to be a teaser, further reinforced by the 2 case studies. And I hoped that more importantly, that you will digest the information and take actions at your respective workplace so that we can collectively augment heat resilience. With that, thank you for your attention.
Thank you so much for that, Jason. What an insightful, packed lecture on extreme heat. I'm sure everyone's found that really useful, and there's some fantastic comments coming in as well in the chat. Our next speaker is Zhang. Zhang is Professor of Management, School of Global Governance, Assistant Dean, and the School of Global Governance, Beijing Institute of Technology. Zhang is a professor of School of Management and the Assistant Dean of Professor at the School of Global Governance and Beijing Institute of Technology. She's the Vice Director of Lancet Countdown Asia Center, the Associate Editor for Applied Energy, and the Editorial Board of Environmental Research Letters. She's an expert, consultant of UNDP for the training and empowering youth to take actions for SDGs, and the UNICEF Climate and Environment Data Advisory Board member. She teaches and advises and conducts research on economic and health valuations of climate change and energy transition, environmental economics, energy policy and management, as well as global governance and sustainable development. Thank you so much. Over to you, Zhang, for our case study. Thank you.
Thank you. I'm going to share my slides. So can you see my slides now?
Yes, we can.
Okay, perfect. Well, hello, everyone. Today, I would like to share some city-level climate change and health response action case study focusing on the temperature-related illness and mortality. Well, let's begin. Well, given current international progress towards climate adaptations strategies, we systematically analyze representative Asia cities' climate health adaptation actions. These case studies span cities with diverse climatic conditions, geographic locations, and economic development levels, providing transferable and replicable framework for future implementation. So the first case study is about Jinan city. It ranks the 13th among China cities in comprehensive development, lies in a warm temperature continental monsoon climate zone with a GDP comparable to Portugal and a population density resembling as Barcelona. Jinan city faced a projected temperature rise about 0.3 degrees Celsius per decade by the middle of 21st century. Well, to combat the air pollution and climate extreme, Jinan's CDC pioneered a high-resolution air quality health index (AQHI) management system by establishing local meteorological health warning platform. This platform integrated environment epidemiology models, real-time air quality monitorings, and meteorological data to deliver multi-sectoral collaboration. They established partnership with meteorological and environmental agencies, enable cross-departmental data sharing and environmental health monitoring. That is a very important and a very innovative mechanism made by Jinan City, because we all know that it is very hard to get the multi-stakeholders to work together, especially for the data sharing. So they achieve the data sharing between different departments at the first place, and then they can do the environmental health monitoring. With the diversification of warnings, they extended to heat waves and cold wave warnings with the real-time health risk forecast for the next 3 days across Jinan's 181 monitoring stations in all districts and counties. The system offers multi-channel promotions, including information released through the official website and WeChat account. Well, if we analyze the direct benefit by the Jinan's case, as a national pilot of the environmental health risk assessment and a CDC environmental health research base, Jinan gets hold of the opportunity to integrate the climate and health governance together with multi-stakeholders, as we mentioned before. And for the health benefits, the heat wave health risk warning have averted about 10.9 related deaths per million people in just 1 year. And for the economic benefits, the heat wave health risk warning reduced the direct economic loss by around $32 million in just 1 year. For the environment benefits, the environmental health platform launched in 2020 provides timely health guidance and has recorded over 220,000 visits on web and mobile. For the social benefit, the system provides different dimensions of AQHI-related information on demand to get 3 phases heat wave and cold wave health warnings and advice to the public. Well, at the same time, it provides the indirect benefits as well. For example, the system strengthens collaborations and information sharing among meteorological, ecological, and environment departments with CDCs and the big data bureaus. As we mentioned before, the sharing the data among the different multi-stakeholders and the government ministries. And then it enhanced the government monitoring and health promotion skills competitions and raised awareness through public outreach campaigns. The second case study is about the Tianjin city. Well, Tianjin city located in the northern edge of Eastern Asia monsoon zone has experienced a temperature rise about 0.38 degrees Celsius per decade since 1960, already existing national and global average. the stroke, the world second leading cause of death, and the Tianjin's third ranking mortality factor, demonstrate high incidence, disability, mortality, recurrence rate, and economic burdens. Unlike the other non-modified risk factors such as age and genetics, meteorological variables represent preventable contributors to stroke incidence. Well, the Tianjin Stroke and Extreme Weather Risk Early Warning System, they did some different innovative mechanisms rather than the example we presented before. They established a high-level innovative platform integrating multiple disciplines of meteorology, environment, and health to promote the transformation and application of science research to outcome. And they built up this kind of industrial academia research collaborations, gathering high-quality resources from universities, hospitals, and research institutions to establish a long-term cooperative mechanism. Well, they developed the health early warning service based on the meteorological and environmental factors, but they launched those kind of information and disseminated the message via the different channels. For example, they can send it to the text message for individuals, and they broadcast it on the TV, a website, a new media, and rural radio broadcast. Well, they also promote a service model of early warning plus multi-party collaborative service. For example, they have the early warning plus health commissions plus communities plus industries plus traditional Chinese medicines and science outreach to enhance the public awareness and the participants. And in total, they achieved the intelligent and standardized development of the meteorological health service to enhance the health effectiveness of the meteorological service in medical and public health application. Well, let's see how does it work and what is this direct impact. Well, for the health impact, following the 2022 extreme cold weather warning, the stroke hospitalization in Tianjin decreased by 1,400 cases year on year. After the 2023 heat wave warning, the stroke hospitalization decreased by 706 cases year on year. For the economic benefits, the release of this kind of meteorological risk warning for stroke has saved already around $4 million in 2022 and $1.8 million in 2023 in hospitalization cost. But in total, it saved around $35 million economic burden from the 16 warnings altogether. Today, meteorological stroke risk warning message have reached the audience around 72 million views, with 110,000 received the target SMS service. What does that mean? That means that when they send out this kind of meteorological risk warning message to the individuals, those kind of 110,000 messages are tailored, personalized, tailored for those kind of receivers. And they provide the pollen-related information as the pollen forecast sections at the WeChat account. Also, the project was included in the National Health Commission's Brain Prevention Committee project and built up one local standards for Tianjin City. At the same time, it promotes the scientific communications by holding multiple national innovation exchange conference and creates the programs and public welfare advertisement. It's a very interesting story. I heard that last year they recorded the crosstalk show video to enhance the public awareness online. And they already received around 2 million views online just for one summer. Well, the third case study is about Dhaka. The Dhaka is the capital of Bangladesh. It's situated at South Asia as the nation's largest city with about 16 million population. Dhaka faces escalating climate impact, particularly extreme heat event. Well, to address the extreme heat, Dhaka has implemented a data-driven, focused, tiered response emergency chain anchored by the heat wave early action protocol, what we call the EAP. This system integrated meteorological and health data to set temperature trigger threshold for early warning and mobilize community-level interventions. They distributing umbrellas, providing drinking waters and cooling centers for the individuals. And they established a community adaptation network for knowledge exchange, and they built up the cross-center collaborations with government agencies, the Bangladesh Red Crescent Society, and the international organizations to ensure efficient resources allocation and disaster preparedness. Well, the direct outcome of the EAP activation for the health aspect, they established 3 cooling centers and serving over 15,000 people and distributed safe drinking waters to 30,000 receptions and distributed 3,500 umbrellas and protective caps to at-risk populations. For the economic perspective, the EAP provides multi-purpose cash grant to 4,000 families with supplemental support for 240 disabled households. For the environment benefits, they set up the cooling station to reduce the direct impact of heat on city residents and distribute the shade equipment. Well, the social aspect, they covered around 6 high-risk regions and disseminated alert to 1.3 million residents and enhanced the community adaptive capacities. Well, for the indirect impact, the community preparedness, they co-developed the early warning system with municipal authorities and creating replicable models for extreme weather management. And they enhanced the agency collaborations with multi-stakeholders. The BRC works in synergy with local government, companies, hospitals, international organizations to ensure the effective implementation of the early actions on heat waves. Well, for the public education, they already reached over 1 million residents with the heat preparedness training. That is a very impressive achievements. Well, the last case study is about the Mekong Delta Community Climate Resilience Initiative. The Mekong Delta spans over 630,000 square meters across Cambodia, Laos, Thailand, Myanmar, and Vietnam, supporting the rural populations reliant on natural resources. The region faced intensive climate risks, including the extreme heat, the rainfall, the sea level rise, with projection indicating escalating impacts. Well, they provide a very different mechanism compared to the formal 3 case studies. The USAID Mekong Adaptation and Response to Climate Change project, they introduced a hybrid top-down and bottom-up adaptation framework, integrate scientific model with community insight to inform decision-making. This approach, they enable the science-driven climate risk assessment with the integration of local traditional knowledge and to co-creation the context-specific adaptation plans together. So they use this kind of initiative to emphasize the integration of scientific driven assessment and the community perspective together, strategically incorporating climate models, environment data set, and other evidence-based tools into decision-making framework, while systematically investigating residents, their own need, and indigenous knowledge. This implementation protocol faced the different approach, like rather than the other case studies. Well, for its economic benefits, by adjusting those kind of planting structures and optimization water resource management, they already reduced the agricultural loss by 38%. Well, the project also optimized the environment, water resource allocations, and protect the wetland ecosystem in the Mekong River basin. For the social adaptivities, they collaborated with 20 different communities to develop the community adaptation method. And for over 48% of the respondents were aware of climate change, and the proportion rose to 87% in the midterm survey when they fulfilled this kind of capacity building among those kind of 20 communities. Well, for the indirect benefits, they reached this kind of regional collaborations and the policy impact by providing a replica community resilience. They building models for other countries in the lower reaches of Mekong River at the same time, and in the build up this kind of long-term ecological and economic gains by receiving water resources and reduce the risk of future agricultural production declines, and also they achieve the USAID Mekong LRCC Impact and Adaptation Study report in this project conduct a comprehensive analysis of climate change in this basin, and they providing those kind of reference for various fields and the productions and the daily life for the relevant countries along the Mekong River, along the Mekong Delta base. So our analysis of the current climate health case study reveals that regions worldwide are developing tailored mechanisms through localized innovations. These initiatives establish the context-specific system integrating climate and health monitoring, early warning, risk assessment, intervention protocols, and cross-sectoral coordinations, achieving demonstrable multi-scaled impact. This pilot program provides us transferable framework for city level, regional level, and global level climate health solutions. So I really want that the participants of our course today and in the future could participate also into this kind of initiative buildings and capacity buildings programs in your region and in your community. And last but not least, I would like to close this case study and with the thank to my research team and to the Lancet Countdown Asia Center team. And let's working together. And if you are interested in this topic, you could contact us and participate into the individual levels actions together with us. Okay, thank you.
Thank you so much. Really loved listening to all these amazing case studies that you just described, Zhang. Our final speaker, actually, just before I talk about our final speaker, a quick reminder, if you want to ask any questions to the two presenters so far, just pop the questions in the Q&A box and we will make sure that we try to ask those questions. So yeah, please do so. Right, our final case study then. So this is, I'd like to introduce now Dr. Kazutaka Oka. Kazutaka received his PhD in theoretical astrophysics. After completing his PhD, Kazutaka worked for a consulting firm for about 14 years. At the consulting firm, Kazutaka worked on research related to climate change, mitigation and adaptation. Now Kazutaka is a researcher on climate change impacts and adaptation with a focus on heat-related illness. Kazutaka is also a member of the Government Policy Committee on Heat-Related Illness. Thank you so much. And it's over to you now, Kazutaka. Thank you.
Yeah, thank you. So I will up my slide just a moment. Okay, so can you see my slide? Okay.
Yes, we can.
Okay, thank you. So hello, everyone. My name is Kazutaka. I'm from National Institute for Environmental Studies, Japan. So today, I'd like to talk about heat stroke and the changing climate and adaptation measures in Japan. Okay, so before talking about heat stroke, I'd first like to talk about the changes in temperature over time in Japan. So this figure shows the change in summer atmospheric temperature over time in Japan. So as you can see, the average summer temperature has increased by 1.31 degrees Celsius by 100 years due to climate change. And looking at the top 5 temperatures recorded to date, 4 of them were recorded after 2010. Okay. And the hottest years so far on record were 2023 and 2024. Okay, so then, so what is the association between heat stroke incidence and, between temperature, radiology, and heat stroke? So the figure on the left shows the association between the daily maximum temperature and the incidence of heat stroke for 4 cities in Japan. And the figure on the right shows the association between the daily maximum WGT and the incidence of heat stroke for 4 cities in Japan. So both figures clearly show that the incidence of heat stroke increases as the daily maximum temperature or WGT increases. Okay, so heat stroke has becoming an increasingly serious issue as the temperatures rise in Japan due to heat island and also climate change. So this figure shows the annual number of patients with heat stroke who are transported by ambulance. So as shown in the graph, the annual number of patients with heat stroke or transported by ambulance is around 95,000. And especially in 2024, it was the extremely hot year. So the number of the patients are, the largest so far. And with climate change causing temperatures to continue rising, the incidence of heat stroke is expected to increase in the future. Okay, so this slide shows the number of ambulance dispatches for heat stroke patient by age group and location of occurrence. So when we look at the age groups, the elderly account for more than 50% of all heat stroke cases. So, Japan is facing with an aging society. Heat stroke is expected to be a more serious issue in the future in Japan. And, while measures designed to assist each nation are, of course, very important, but measures centered on the elderly are very, very important, particularly important when we look at the statistics. And when we look at the location of occurrence, most heat stroke occurred at residence, and that share is approximately 40% of all cases. Of course, specific measures to reduce the number of patients or location is important. But looking at this statistic, we can see that measures for people's residence are particularly important. Okay, so this slide shows the number of deaths, heat stroke deaths in Japan. So average number between 2020 and 2023 is about 1,500. And so considering the number of deaths from natural disaster in Japan in each year is between 100 and 200. So you can see that the number of people who die from heat stroke every year is very high compared to the not those by natural disaster. And in addition, 85% of the people who die from heat stroke are elderly. This line shows the percentage of elderly. So while specific measures for each generation are, of course, very important, but looking at this statistics, we can say that the measures for the elderly are particularly important. So we are already facing serious risks of heat stroke. And to reduce the risk of heat stroke, many adaptation measures against heat stroke have been implemented in Japan so far. Among them, one of the latest adaptation is heat stroke alert, which was deployed in 2020 in Japan. Under this initiative, a heat stroke alert is issued when the WBGT is expected to reach 33 degrees or higher. This alert initiative was initially only issued in some limited region in Japan in 2020, but this initiative was expanded to other regions in 2021. And in 2024, which was extremely, it was very extreme hot year, and 1,722 alerts were issued across Japan. So this, heat stroke alert system is a key part of Japan's effort to combat heat stroke. Okay, in addition to heat stroke alert, heat stroke special alert was newly started in April 2024. So this system is for precaution against extreme dangerous heat we never experienced before. In this initiative, a heat stroke special alert is issued when the WBGT at all evaluation points in the prefecture are expected to reach 35 degrees or higher. So this figure shows an example of how heat stroke special alert and heat stroke alert are displayed on the map. To emphasize the level of danger, heat stroke special alert are shown in black, while heat stroke alert are shown in purple. In 2024, no heat stroke special alert were issued in Japan. And also an initiative called the cooling shelter has also started in April 2024. In this initiative, the mayor of a city, town, or village is required to design facilities that can be used to avoid the heat during period of extreme high temperatures. And a cooling shelter map is also available to help citizens to find nearby shelters. So far, I have just looked at the impact of high temperatures. In recent years, however, there has also been concern about the occurrence of a compound impact. One example of this is a typhoon that made landfall in September 2019. This typhoon was the strongest to hit Japan since record began. So this typhoon made landfall in the Kanto region on September 9, 2019, this causing extensive damage to property. And it also caused 9 deaths and 106 injuries in the Kanto region of Japan. And in addition, due to the power outage, the number of people in Chiba Prefecture who were transported by ambulance for heat stroke between September 9 and 15 rose to 498. So this is nearly triple the number in the previous weeks. So compound impact like this could increase the number of heat stroke cases considerably. So urgent action against compound impact is required. So now I'd like to shift focus to what heat stroke might change in the future in Japan. So firstly, how much temperature will rise in the future depends on the amount of greenhouse gases we emit going forward. So as it's difficult to predict exactly how much greenhouse gas will be emitted in the future, we usually use the scenarios to explore a potential outcome. One commonly used set of scenarios is called RCP scenarios. So 4 RCP scenarios are listed in this table. Here, RCP 2.6 assumes strict measures to combat global warming. So this links to the lower future emissions. On the other hand, RCP 8.5, this assumes little to no count measures to global warming. So this results in the highest future emissions. So this figure shows that and the RCP 2.6 scenario, temperature increase is expected to limit it to around 2 degrees by 2100. While when we look at RCP 8.5, this could lead to a temperature rise of up to 5 degrees. So the extent of future temperature increase will vary considerably depending on the level of greenhouse gas emissions. So this slide shows how the annual temperature in Japan will change in the future. Under the RCP 2.6 scenario, the temperature increase is projected to be around 1.9 degrees Celsius at both the middle and the end of the 21st century. On the other hand, when we look at RCP 8.5 scenarios, the temperature increase is projected to be about 0.1 degree by the middle of the 21st century. But when we look at the end of the 21st century, this temperature is around 4.8 degrees. So then, how will the risk of heat stroke change in the future? We conducted a study projecting how the number of patients with heat stroke transported by ambulance will change in the future due to climate change. And in this impact assessment, we also considered effect of long-term heat adaptation. So the results show that the heat stroke incidence will increase in the future. So now we set the now base year is unity, but we can see that this number will increase in the future due to climate change, even if we consider the effect of long-term heat adaptation. So this result suggests that heat stroke incidence will increase in the future, even if we consider the heat adaptation. Thus, the need for the further heat stroke prevention measure is suggested from this result. We can see from this result. So another example of our study is that there may be instances of difficult ambulance transport due to more requests for ambulance that can be met. Future predictions were made regarding the possibility of incidents of difficult ambulance transport due to extreme high temperatures. The results show that when extreme high temperature occur, there is a significant increase in heat stroke-related ambulance dispatches. So as a result, this could lead to a shortage of ambulances. Thus, the need for effort to reduce the risk of heat stroke and the proper use of ambulances are suggested. And we also collaborate with local government on research project. To implement effective adaptation measures, it is essential to understand the regional situation concerning heat stroke. In this context, we work with local government to conduct meteorological observations of the local heat environment and analyze heat stroke-related emergency dispatch data in the corresponding region. So this slide shows some example of the data visit observation conducted by the local government. And these observations are being carried out in various locations to better understand local heat condition or environment. And this slide shows some example of analysis of and projections related to heat stroke dispatches and WGT. So activity for awareness raising are also being conducted to help community to better understand the risk of heat stroke. So we hope that this finding will be used to promote adaptation measures and plan in the regions. And we are also working with industry to implement adaptation measures. By raising awareness of the heat index and promoting its use, we aim to encourage people to take measures to prevent heat stroke. For this purpose, we are establishing a research group and conducting a feasibility study on, for instance, the necessity and use of smaller WGT methods, for measures to popularize WGT methods, for measures to increase awareness of WGT, and effective measures to promote heat stroke prevention behavior. And to gain a broad range of insight, this research group is inviting companies and organizations from various industries to participate. Through this initiative, we hope to introduce effective adaptation measures and reduce the risk of heat stroke. Okay, so this is the final slide of my presentation. So let me summarize my lecture. So with the risk of heat stroke already increasing in Japan, further rises in temperature will have even more serious consequences in terms of heat stroke. However, heat stroke can be prevented if appropriate measures or adaptation are taken. So we NIES are promoting various activities to help reduce the risk of heat stroke in collaboration with relevant organizations. So we look forward to working with you all in the future. Thank you.
Thank you so much, Kazutaka. That was fantastic. Wow, I feel like I've learned so much. What we're going to do now is there's loads of questions that have come in. You might want to take a little look on the chat. There's lots of people saying thank you to all of you, the speakers for today and the case studies and lecture. Thank you. We're going to go to the questions now. We've got about, just over 15 minutes. So I'm just going to go to this slide so you can see who our speakers are again while you ask the questions. Oh, that's not working. Stop. 1 second. Oh. All right, I'm going to go straight into the questions because I can't do the share and look at the screen of the questions. So, okay, this is a first question to Jason Lee, and this is from Dr. Abhishek Bhatia. Can extreme heat events be classified as outbreaks and integrated into NCDC, national, regional, and global frameworks that govern outbreaks to better understand how society perceives and responds to them?
Thank you. Yeah, the short response is yes. Though to me, it could also be seen as an emergency response. In this case, you call it an outbreak. But the point here is it's important that a coordinated response must be in place. This is really a whole of society, whole of government exercise, understanding to who are potentially the ones they are underlooked, because there's only how much resources we have. And if we don't coordinate and optimize whatever resources we have, they will always be insufficient. And so I ask whoever asked that question to first think about in that particular context, may it be a village, community, or a country, what is the governance like? Who is in charge of this? Heat is unique in the way that it is everyone's business, but sometimes that can also mean it's no one's business. And also who owns it, who is responsible, and also the governance is critical. Thank you.
Thank you, Jason. I've got a question for Zhang, and it's by Gerard Finnegan. The World Health Organization have estimated just over 50% of global deaths have death certificates issued. So no indication of cause of death or factors contributing to death. As climate change health and advocates, how can we have confidence in arguing the increasing rise from death when mortality data or macro models, often not validated against real-time data, have large errors in confidence? Aren't we at serious reputational risk of overestimating or underestimating these risks?
Well, thank you for the questions. Obviously, a very professional one, and from us, we all understand that it is very difficult to collect all this kind of hospitalization levels data, not only at the regional level or domestical level or global level. It's very difficult to get the data, not only for mortality but also very difficult for mobility. So for the researchers, in our scientific research, methodology part, we all accept the currently integrated response exposure response model. That is what we used to estimate the mortality rate and caused by the extreme weathers. And so, it definitely that some of the reviewers may mention that we over or underestimated this kind of risks, but that is what we had so far. So I think Professor Jason has raised up his hand. Maybe he could further explain this question. Yeah.
Yeah, if I may, I just want to echo and reinforce, but also highlight that there are many of such heat-induced cases not seen at hospital. I know many of those who are really vulnerable don't actually end up in hospital. So to that question, it's for sure a significant under-quantification of the heat health impacts. But look beyond the hospital. You might even argue, well, for mortality, we are predominantly interested about excess mortality. If the hot season, more people pass on, we know heat is the cause, That is fine. But I'm saying that beyond that analysis, there are a lot more for us to quantify. Thank you.
Thank you both, Jason and Zhang. Right, I've got a question for Kazutaka next. This is by Erika Merigliano. When we say extreme heat event in a certain area, do we only get the average temperature or do we include the humidity in that?
Yeah, thank you for the question. So in Japan, so we don't have any, formal definition of extreme heat temperature. But with regard to my study, I defined the extreme temperature as the maximum daily temperature that occurs every 50 years. So, usually it's very difficult to define what is extreme temperature, but in my study, I defined that way. So important point is that, considering the, observation record, so what is the extreme? So we have to think about that in detail, looking at each, regional situation. Yeah, thank you.
Thank you. All right, I've got another question now for Jason. And this is an interesting question because I've been thinking about the same thing and somebody asked it for me. So, are there already studies on the effect of heat increase on sleep?
Yes, again, in fact, one would argue, do we need more studies to show heat compromises sleep? Just imagine if I put you in an uncomfortable room, maybe too hot, too cold, too smelly, too noisy, right? The answer is you cannot rest well. And we know if you don't rest well, accumulative, you cannot function well. So you might not die of heat stroke directly, but your lack of concentration might increase your risk of accidents and be compromised in other ways. So pertaining to heat and sleep, it's quantified that poor thermal discomfort, you can't sleep well. So yeah, and also right now the response is then how can we optimize our sleep beyond just turning on the air condition? Thank you.
Thank you. I think there needs to be more studies on that too. Next question is to Zhang, and it is, were there studies already, oh no, sorry, that's wrong. I'll come back to that one. That's Jason a bit later. What exactly happens in the cooling center? For example, in the Bangladesh, are those cooling centers established by a community or are they funded privately?
Well, this Dhaka, like a Dhaka case study in Bangladesh, the whole project was sponsored by the International Federal of the Red Cross and also the Bangladesh Red Crescent Society. So those international organizations and the government agencies, they pre-arrange the fundings to support rapid response efforts when those kind of heat wave happened. So that those are not private sponsored cooling center. They are built up by those kind of like Red Cross and the Red Crescent Society of Bangladesh government. Yeah.
Thank you. Next question is to Kazutaka. So this is by Gerard Finnegan. Can you please discuss the efficacy of the approaches in the case studies or describe the approach or measure how these DRR interventions actually reduce mortality and morbidity and by how much? Magnitude of change in risk. They are wonderful case studies with much discussion on the activities and theoretical effect. However, have these interventions actually reduced mortality and morbidity caused by the heat stress? So quite a precise question there.
Yeah, thank you for your question. So with regard to the measuring impact of adaptation measure, I just want to talk about the effect of introducing heat stroke alert. And so this is just the study under development, but yeah, we try to measure the impact effect of introducing heat stroke alert, and by comparing the number of patients transported by ambulance by heat stroke during heat alert and during no heat alert, we compare the number and we try to measure the effect. And at this moment, we find that the number of patients increase when heat stroke alert issued. This is because alerting heat stroke increase people's awareness for heat stroke. That caused the increase of heat stroke alert. But this is still kind of fast result. So we try to investigate study in detail in the future. Thank you.
Thank you. Now this is a question to Jason. It's by Andrea Gurriara. Considering that each person can react differently, could it be possible to mention a cutoff, a cut line for maximum temperature and time of exposure to that exposes extreme risk?
Yeah, thank you for that question. Answer is no. Because whoever asked the question, you already provided the answer. Everyone is different. I understand from a policy level, there's only how much you could do. So setting out threshold that works for the majority. But if the aspiration to save everyone from extreme heat, right, you can't depend on policy giving that broad threshold. Because whatever policies that's based on environment index is just accounting for one of the three key determinants I just shared about. That's the weather. How about the attire? How about the physiology, the motivation of the work? Is it by piece? Is it fixed salary? All these are important factors to consider when you assess one's vulnerability to heat stress. So it depends if the aspiration to save everyone. I hope so. Then we cannot depend on broad brush policies and hope and pray that we save everyone. That doesn't work. Thank you.
Thank you, Jason. We've got a few more minutes. I just want to ask one question that's really piqued my interest, and it's to Zhang. I've been seeing many women in Peru menopausal period complaining of severe hot flashes more than usual. Are there any suggestions on how to mitigate heat on them?
Well, as far as we know, that the whole heat wave thing has been escalating regionally or global worldwidely. So I think the first thing we could do or we could adapt to that is to raise our awareness about the heat wave self adaptations, not only for your individual's levels production, but also for your friends or relatives. First of all, you should know that the temperature matters. For example, the threshold mentioned by Professor Oka, that you need to pay attention to the very high temperature, for example, over 35, over 30 degrees Celsius. But the other thing is very important is the humid level. For example, if you are exposed to a situation that is only 28 degrees Celsius, but with the 80% humid level, it is also very unendurable. In some situation, especially in Asia, different countries in Asia, so that at that circumstances, you should remind yourself to change your behaviors. For example, what we talk about the cooling center, drink more water, and get some shelter or cab even. That could be very protective for yourself. And also, that is very important to remind your family, your friends, especially those vulnerable groups, including children, the elderly, pregnant people, and laborers who are working outdoors. Because it is very hard to change our behaviors. So I think that is the first thing we should do and keep in our mind to mitigate this kind of heat risks around us. Yeah.
Thank you so much. We're down to just the last 2 minutes, so we're going to have to stop on the questions there because I just need to round off before we finish the session for the day. So thank you to all of you for asking those amazing questions. And I'm sorry we didn't get through all of them, but I did try to ask as many as we could. There are going to be resources available. So I'm just going to do a quick slide share, screen share even. Can you see my screen?
Not yet.
You can?
No.
All right. No. All right. Let me try that again. There we go. You see it now?
Yeah.
All right. Just a reminder that we have got a WhatsApp group and a WeChat group. So you can scan these for updates and information from the course planning team. That's all of us, all the universities at the bottom of this screen that you can see. It's a real privilege to be able to work with such an interesting group. And I know it will be a great group to join because you'll be able to keep in touch. So there's WeChat for China and WhatsApp for other parts of the world. Don't forget there's a post-session survey as well. So you need to go scan this and you'll be able to go straight into that survey just for today's session. Thank you so much. It's been an absolute privilege to do the moderating for today here at Monash University, Malaysia. So thank you everyone for your attendance. See you again soon.
Thank you.
Thank you. Bye.
Bye-bye.